Hi, everyone. It's 10 o'clock and time to get started. I'm Nancy Langdon, Associate Dean of Accreditation and Strategic Initiatives at the Lewis College of Business, Brad D. Smith Schools of Business at Marshall University. I'm excited to be with you today. Welcome to the Herd Insights Small Business Webinar Series. We thank you for taking the time to attend this event. It's part of a webinar series given by the Lewis College of Business faculty and local business professionals. The series showcases the combined expertise of our best faculty and seasoned and knowledgeable practitioners from the business community in which we engage. The goal of the series is to help small businesses achieve success in a changing and dynamic business environment. Before we start the event today, I would like to say a few words about the college and its mission. The vision and mission of the Lewis College of Business, Brad D. Smith Schools of Business, is to be a next generation business school and to promote a high quality business education and economic development. We do this by implementing our strategic priorities for external engagement, including lifelong learning programs, the Business Leadership Symposium, the Dean's Distinguished Speaker Series, and the CEO panel that many of you have attended in the past. The college also has outreach centers, including the Center for Entrepreneurship and Business Innovation, or the I-Center, that helps small businesses innovate with a focus on design thinking techniques, and the BB&T Center that promotes consulting and research projects between students and the community. Our new transformative Sales and Service Center provides sales training and networking opportunities. The college also cooperates with the Brad D. Smith Incubator to help promote entrepreneurship throughout the region. As the nation and the state are rebuilding businesses and economies coming out of the pandemic closures and lockdowns, the Lewis College of Business is committed to supporting our local businesses, alumni, and other stakeholders in re-engaging, recharging, and redesigning their business models. Hence, we have developed this webinar series that consists of presentations on topics such as strategy, technology, marketing, finance, and more. We hope you enjoyed today's presentation and take something out of it to use in your business or professional activities to make West Virginia and the surrounding area a better place for business and community engagement. Today's informative and engaging presentation is titled Ongoing Employment Issues During the COVID-19 Pandemic. It is brought to you by Dr. Jamie Halleck and business professional Christopher Mokas. Jamie is an assistant professor of management and has been teaching statistics and management at Marshall for over 20 years. His research interests are in the fields of organizational behavior and justice. Christopher Mokas is the Director of Human Resources at St. Mary's Medical Center. He also oversees human resources at HIMG and Three Gables Surgery Center in Proctorville. Jamie and Christopher will explain more about employment and human resource issues, including justice, during the continuing pandemic. Please feel free to ask questions via the chat function throughout the presentation. Jamie and Chris will answer these questions at the end. I now turn it over to our presenters.
Thank you, Nancy, for that warm introduction. And I also would like to thank you and Alina for inviting me to this presentation. And also, most importantly, like to thank Chris for coming aboard and helping in our presentation. Chris has been a big help to me. I've asked him to come in. He spoke to my one of top principles of management classes. He's come in and spoke to those and been a great benefit to our students. So I appreciate him helping in this presentation. So the agenda for this webinar here, what we're looking at here is ongoing issues with the COVID-19 pandemic. And the agenda, what we want to talk about here, I will introduce the employment issues for discussions first. So we've picked out 3 issues that are kind of things that we think that all organizations may be facing at this time. And then I'll give the framework for discussion. So we're going to come from I'm going to come from a justice perspective and a justice discussion about how these issues that we're experiencing in the workforce, how justice has an impact on those, or justice can have an impact on those. And then I'll turn it over to Chris, and Chris will talk about some of the current practices at St. Mary's Medical Center. And then it'll be followed up with some other employment issues that St. Mary's has or is currently involved in, and then some other things or some other issues that we may see in the future when it comes to a business. So the three kind of big employment issues that we thought a lot of organizations are dealing with right now that we want to discuss was employee recruitment, employee policy development, and employee exhaustion. So I know Chris is experiencing these. We've discussed this, and I hear a lot from students, from people in the community, from business owners, business leaders, managers. And so we hear that these problems are occurring. So we thought these would be a few good ones to kind of look at and kind of look at from a justice perspective. So the first thing we want to do is we want to define what organizational justice is. And even before we define it, why organizational justice? Why should we even care about organizational justice? Well, one of the reasons that we should care is because that this organizational justice and the different factors of justice have a large impact on the outcomes that employees have. And those can be good outcomes, or they can be negative outcomes, so positive or negative. And we'll look at those as we go through the slides with each individual type of justice. But what organizational justice is, or fairness, is how employees perceive fairness in the workplace. The one thing I want to point out is just because you think you're making it fair doesn't mean that it is fair. Fairness is based on perceptions of the employee. So they may look at things differently than you do as the manager or as the supervisor or something of that nature, that capacity. So they'll look at it different than maybe what you do. And you may think that in your eyes that you've created this really fair policy or decision, and they may not see it that way. So we need to remember that. So justice also, this is another part to look at, gives the individuals a frame to make judgments about what is perceived to be acceptable or unacceptable with regard to preconceived norms. So we have these already inside of us, these thoughts, and then the way we interpret things, the perception we have of it, will impact the way that we respond. Now, the thing about organizational justice research, it's one of the most studied topics in the management literature. And it's the reason behind that is because there's a lot of attitudes and behaviors and different types of outcomes that come out of that. As you also see here, I've noted that it can be organizational justice can be looked at as either a glue or a solvent. So when individuals have a higher perception of organizational justice, it can actually be a glue and kind of tie people together. All right. On the flip side of that, if they don't perceive, or if there's lower perceptions of organizational justice, it can be like a solvent, and it can erode those relationships. And I kind of look at it this way right here. I kind of thought of a scenario. I use this when I teach about teams and bringing individuals together. If you think about, and I use analogies from the sports world. So a lot of times you will have like I always talk about the Kentucky Wildcats. Each year they bring in a new group of freshmen and they try to put the team together. They've got all the right components, but sometimes those teams come together, all right? And sometimes they don't. And sometimes there can be something, the coach may set up some type of activity inside there to bring the individuals together. Or on the flip side, there could be something that occurs inside there. It's like that solvent that pushes them away. So what we want to do is we want to look at these justice perceptions and the influence they have on these issues that we're facing. So the types of organizational justice that the literature discusses is 4 types. So we want to look at distributive justice, and we'll tie that back into employee recruitment. We'll look at procedural justice and how that's tied to employee policy development. And then the other 2 are combined sometimes, and they're called interactional justice. But the literature has broken those down into 2, which we call interpersonal justice and informational justice. And we'll define these as we go through those. But we're going to look at the impact that they have on employee exhaustion. So we'll start with distributive justice. So what is distributive justice? Well, it's the perceived fairness and outcomes we receive compared to our contributions. All right. So the outcomes can be many different things, but it's something we're going to receive. So it may be a raise at the end of the year. It may be a bonus. It could be the time that we're given, like the shift work we're given. So we may get a better shift than somebody else. So there's all these different types of outcomes. Maybe it's a vacation bonus or something of that nature. So we look at these outcomes, and then we say, okay, were they distributed fairly? And what is our perception of that distribution? Now, the way that we look at how that affects individuals is we use equity theory to explain these. So Adams came up with this equity theory in 1963, and he said what we do is we compare ourselves to another, and we look at this ratio of what we call inputs to outcomes. All right, so what am I putting in and what am I getting back? And what I'm going to do is I'm going to compare that to another individual. We call that our referent other. So I'll form a perception, and that's going to, when I form that perception and I compare it to the other individual, it's going to put me in a balance of either equity, so everything's good, or an inequity. So it could be a positive inequity or it could be a negative inequity. Now, what happens is if we experience an inequity, then we'll have a distress based on that perceived inequity. And the greater the perceived distress, that's a stronger motivator to restore it to an equitable relationship, because we want equity. We don't want to have an inequitable state, is what Adams was saying. So, for example, say that Chris and I are up for raises this year, and Chris gets a 5% raise and I get a 1% raise. All right, so in my mind, I'm comparing, well, how much work did I do this year? And then what's my outcome? And I look at Chris and see how much he worked. So if I say, okay, Chris and I both put in the same amount of work, then there's an inequity, because if we both put in the same amount of work and he got a larger raise than I did, then I would experience an inequity, saying there's a difference in that distribution of outcomes. Now, the ways that I can adjust that is I may say, and I may look at it differently, is I may say, okay, well, Chris got a larger raise, but maybe Chris is a harder worker than I am. All right, so maybe that he works harder, so that's the reason he got the larger raise. All right, now on the flip side, Chris can look at it and say, well, I got a 5% raise and Jamie got a 1% raise. Why did I get such more? So he would also be in this period of inequity. And he would say, okay, so what can I do about that? So he may look at it from the psychological standpoint, say, okay, well, I worked harder, I deserve it. All right, or I've got more knowledge and I deserve it. And at the end of the day, then what we do is we look at those, but we want to restore that into a position of equity. So the outcomes that we're going to look at, which is on the next slide here, is what some individuals will do is they may adjust these outcomes, all right, or they'll lead to certain outcomes. Let me rephrase that. So back to equity theory. So say if Chris says, well, I got more of a raise, then maybe this year I'll work harder. All right. Or on my side, where I've got less of a raise, maybe I say I'll work less. So the outcomes that we see from distributive justice is that if justice is perceived to be as high in the organization, distributive justice, we'll see a positive correlation with pay and job satisfaction. We'll see higher performance. We'll see higher organizational citizenship behaviors. That's where individuals will want to go above and beyond to help the organization. Now, on the flip side, say that notice we're probably in the situation where Chris would be in the positive equity situation here. He would be more likely to perform higher, be satisfied with his job. On the opposite side, where I've got the lower raise, I may be at a state where I want to retaliate against the organization. Some of the research has shown that some individuals or employees will actually engage in sabotage, and some will actually engage in employee theft. And we don't want that to occur. Part of the thing that we're looking at with this discussion today is how to keep employees happy and the organization happy. So how does this distributive justice factor impact the recruitment? So probably a lot of you have seen a sign like this recently, probably in almost every business you've went to. You've got a now hiring sign or help wanted sign. So when we go to bring these new employees in, or we're trying to attract these new employees, what are we doing to attract those? Well, one of the things that you see a lot of organizations doing is they're offering higher wages. So from a distributive justice perspective, where that becomes an issue is what if I have employees that are already working and say they're just making a salary up here, say they're making $15 an hour, and then all of a sudden we need new employees and we can't get them, so we have to raise the rate, and we raise to say $20 an hour. How are those employees that are already working, they're going to feel because of the distribution of outcomes here when the new employees are coming out with a higher salary? So they may adjust their inputs in relationship to those outcomes. Sign-on bonuses would be another one. So if you're offering sign-on bonuses, what are the employees that are already working there thinking? I actually had a story the other day where an individual was telling me that one of their company they work for to attract employment, instead of offering the sign-on bonuses, they're actually offering the sign-on bonuses to the employees. So if the employees can recruit people, then they'll give them the sign-on bonus. So it's kind of reverse there, and that kind of helps also. But then it could create a reverse inequity position too. And paid vacations would be another example. We see some companies that are offering more vacation if you'll be attracted to them. Again, what type of issues could they cause? Now, the next type of justice we want to look at is what they call procedural justice. So procedural justice looks at, okay, were the distribution of resources that we're talked about with distributive justice, were they the system that was used, were the procedures used to distribute those resources, was that fair? All right, so was there a fair process? And some of these elements include, was the process, let's say we're looking at raises. At Marshall here, we have merit pay raises. So we have a policy for that. Was that policy developed fairly? And do employees buy into that policy? And I can say as a faculty member that we were able to actually help in that. We actually just developed that policy. So that gave us fairness, that we felt like it was being taken care of in a fair manner. You also look at, was the quote unquote measuring stick used in the evaluation process, was it developed fairly? All right, so if we're looking at maybe car sales, so what method are we using to figure out whether our salesmen each month, salesmen or saleswomen, are hitting the right numbers? How do we develop that measurement? And then lastly, was the individuals who were creating this policy, was it a fair selection of those individuals? And we'll talk about that a little bit more in another example here. So to kind of draw the idea of procedural justice home, let me give you an example of it. So say a company had a policy in the past where that you could accrue vacation. So you don't use your vacation by the end of the year, you can accrue the vacation. So you start accruing vacation. Well, after a while, maybe a few years, the company says, okay, we don't want to accrue that vacation on our books anymore. So we develop a new policy. So all of a sudden, it's near the end of the year, HR comes up with this new policy and says, look, here's the deal. You can sell your vacation days back that you've banked over the previous years. And what we'll do is we'll give you 50% of that, or you just lose those days. And you think about that from an employee standpoint, was that fair? Who made the decision? How did they make the decision? Were the employees asked their thoughts about it? And what was the reasoning behind this? So you can see there that could cause some uneasiness inside the individuals. So some of the outcomes that we see when procedural justice is high, the employees are satisfied with their job, again, committed to the organization. Trust is a big one. So if they feel like the company's using fair procedures, then they'll trust the company, they'll want to cooperate with it. There'll also be a trust toward management. Evaluation of organizations and supervisors will be positive also. But as we look at, and this is where my research usually heads to, is that we can also have on the negative side, both personal and organizational counterproductive work behaviors. So employees can do things that are counterproductive to work. So with the way that we explain this, we can't use equity theory to explain procedural justice. So what we do is we use a different theory, and the theory we're going to use is social exchange theory. And what that says is individuals respond to how they're treated or how they believe they will be treated in the future. So those outcomes that we looked at previously is those responses. Well, if the organization was good to us, we'll be good to the organization. If the organization was bad to us, then we may return that in some negative format. So how does this affect us when we're looking at COVID-19 policies? So for example, Marshall has a surveillance testing policy where employees that actually before the semester started, employees would be tested that hadn't been vaccinated. And then there's an ongoing testing, which is random testing. And the items that we want to consider when we develop these policies, and Chris is going to talk more about this later, is we should be transparent, We should give people a voice. Impartiality should be involved. I know that the university, when they developed these policies, they had task force and committees, and they incorporated a lot of people to make sure they came up with a policy that people thought was fair. And that's what we want to do within the organization, is we want employees to buy into the policy. So the more fair they think the policy is, the more likely they'll buy into it. Now, as we head toward the next part, or the interactional justice, I want to stop and define what emotional exhaustion is. So emotional exhaustions are feelings, as the literature defines it, as feelings of being overextended, depleted of one's emotional and physical resources. Forbes defined it as a state of emotional, mental, and physical exhaustion caused by excessive and prolonged stress. What's interesting, or maybe not interesting, is emotional exhaustion was already there before COVID-19, the pandemic. All right, so there was a lot of issues with emotional exhaustion in a lot of different industries. And what we're seeing now is it's kind of being brought more to the forefront because of what's going on in these different organizations. So it may vary by industry. And what I mean by that, it may vary by industry, is that some industries are more on the front lines. So Chris is going to talk about the healthcare industry. They're seeing people that are coming in that are sick from COVID, that are dying from COVID, and it's taxing on their system and their body. We also have individuals that are in retail establishments, and the customers are coming in. They're on the front line, so to speak, working with customers, seeing the customers face to face on a daily basis, and they're tired too, because they don't have product to sell. The product's not being delivered as it's supposed to, and they're not getting shipments like they need to. So they're also going to have an emotional exhaustion that's going on here because of what they can't control also. So as we look at these two here, so the first one we'll start is what they call interpersonal justice, and it's the degree to which people perceive they are treated fairly. So did my supervisor or manager treat me with politeness, dignity, respect by those in position of authority or by a third party with regards to execution of procedures and distribution of outcomes? So this is kind of the delineation of distributive and procedural justice. So does my boss treat me fairly? Does my boss treat me kindly or with respect? Now, we'll talk about how that affects here in a minute, but I want to give you an example to kind of drive this idea home. So a lot of you in the retail industry have policies that where after Thanksgiving, your employees are not allowed to take vacation because that's the busiest time of the year. So if you're a Walmart or something like that, they have policies where you can't take off. And some of you may have put policies in where employees couldn't take off during other peak times, depending on your industry, because you have individuals coming in, you've got a lot of work going on. So you've set these policies up. So say you know there's a policy, but you go in and you ask the manager and you say, or the supervisor say, hey, can I get next week off? And the supervisor says, no, you can't have next week off, it's policy. Now say maybe a couple weeks later, you find out that somebody else in your department was granted vacation the same week you asked for vacation, but you also happen to know that they're real good friends with the supervisor or the manager. And what happens is you say, well, that wasn't fair to me. That superior, that boss was not treating me fairly. They didn't execute the procedures fairly. They were not supposed to have vacation, but they gave it vacation. So that's an issue that you could run into. And again, well, how does that, we'll get to that in a minute, how does that lead to the emotional exhaustion? We'll get that here in a minute. But some of the outcomes that we have from interpersonal justice is we have the leader-member exchange. It can be better. So that's the interaction between your leadership and your employees can be better if interpersonal justice is high. Again, employees will be satisfied with their jobs. But the key one here is when perceptions are low, there's a lot of counterproductive work behaviors aimed at the supervisor as opposed to the organization. So they may take direct hits at the supervisors, what research is showing us. So how does interpersonal justice and emotional exhaustion interact or impact each other? So say that you're in one of those situations where you wasn't granted that vacation you were looking for. So that could cause you anger. It could cause you hostility toward that individual. It could also add to your stress level. All right. And so think about this with emotional exhaustion, we're almost at our breaking point or at our breaking point. And then a situation like this occurs, it could be that tipping point that pushes us over the edge, so to speak, as we would say. Also want to point out that emotional exhaustion is one of the core factors of job burnout. And we know that if people are burnt out at their job, research shows us that they're going to look, they're going to plan to intent to go to other organizations. They're going to look for other jobs elsewhere. They may quit. So we don't want to get to those levels. So we want to try to stop that. Informational justice on the other side here looks at whether the organization gave us information or distributed information in a fair manner. As lower level employees, they're not always they do not always have access to all the information that those in the upper management may have. So they will perceive whether it was given to them fairly or not. So let me give you kind of an example of that. So say a company decided to redo their IT structure, their whole computer network system. And they pick employees from each, maybe department, maybe a few from each department, and they send them off to have them trained and certified in a certain type of computer development, network development, and they bring them back. Then they work, so they get trained, they get certified, they start working on the project, they redo the computer system. At that point, not all those individuals are needed. So some of those individuals were sent back to their different departmental areas. So then fast forward, say a couple years, and you still have that project team that's working because they're doing the maintenance, keeping up the computer infrastructure, and all of a sudden a job in that department comes open. So the individual that was on the original team decides to apply for that job. So they apply for the job, and then when they apply for the job, they go to the interview, and they're going through the interview process, and it comes up the concept of certification or recertification. And the employee says, well, I didn't know I needed to be recertified. And then they come to find out that the organization only decided to send the recertification process information to those employees that were still on the project, not those that were there previously. All right. So what happens is now we have a situation where the individual, because they didn't have the information to get the recertification, now they're in a situation where they're not qualified for the job. So this is how informational justice can really impact an individual. So some of the informational justice outcomes, again, leader-member exchange. If we don't feel like we're getting the information, well, then we may hold that against upper management. Counterproductive work behaviors aimed at the supervisor as opposed to the organization, again. A positive relationship with job satisfaction, and then communal relationships will be high also. So how does this informational justice perceptions fit in with emotional exhaustion? Well, again, if you're that individual who didn't have that information, you may feel anger, you may feel helpless, like it's out of my control. That may lead to your feelings of emotional exhaustion. It may exasperate those just a little bit. Another example of kind of a tie-in here, recently, I had an individual that was telling me that they were working with an individual, and the individual they were worked with had COVID-19. And they were exposed to COVID-19, but the organization decided not to explain to them or not to tell them that they were exposed, and they felt like they should have got that information. So again, we're loading onto that stressful situation. These individuals are experiencing more emotional exhaustion. So before I turn it over to Chris, I wanted to give you a few things here to kind of look at to see if your employees are experiencing emotional exhaustion. So one of them is if your employees are failing to meet deadlines. Another one is if they have a lower commitment to the organization. If you start to see that they're starting to miss more frequently, there may be something going on here. And if you have a high turnover rate, that may mean your employees may be emotionally exhausted, and you may want to do some investigation of that. So at this point, I'm going to turn it over to Chris, and he's going to explain some of these different areas with regards to St. Mary's Medical Center.
Thanks, Jamie. I appreciate the invite. You and Nancy invite me to the College of Business to come talk. It's always good for us to share with community members what's going on at St. Mary's and Mountain Health. Obviously, listening to the beginning of your presentation, a lot of that resonates to the healthcare industry and what we're seeing from a recruitment and retention standpoint. Specifically on the nursing side, from a Mountain Health St. Mary's perspective, we're having a lot of our nursing staff right now are going to travel for a variety of reasons. They're getting large amounts of increases in pay. They're getting their student loans paid back. It's a great opportunity for nurses who don't have any commitment for the area for them to go see a country. But they are normally going on 12-week assignments. But what that does is provides a real challenge from our perspective as far as covering those particular staff members. So we've really been challenged from a recruitment retention perspective. We're looking at new ways of retaining nurses. We're offering, especially just to give an example, in our School of Nursing, we're offering those students, if they want to, if they'll agree to a 4-year commitment through Mountain Health, that we'll pay for their tuition, books, for them to finish school and cover all their, schooling in order for them to finish, but with a 4-year commitment to stay within the Mountain Health. So there's a lot of things we're doing from a recruitment retention perspective, but it is a real challenge right now in what we're dealing with COVID. You go to the next slide, Jamie.
I'm trying to.
I got you.
There we go.
One of the things that we've really been hit with, and Jamie talked a little bit in his presentation, is obviously COVID-19. It's a real challenge, obviously, from a community perspective, but it's a real challenge from a hospital's perspective. One of the first things that we did was develop a COVID vaccine policy. And what we do from policy development at St. Mary's and at Mountain Health is most of those are developed through our managers. Whether in this case it was developed, COVID, our vaccine policy was developed through our infection prevention department. That's then given to our administrative team, our vice presidents to look at. We do have physicians on occasions look at that. And then obviously that's provided to HR. At that time, I'm over the policy administration for St. Mary's, and I'm part of the group for Mountain Health as well. We then look at it, make sure it's in the proper format, make sure it meets all the qualifications that we need from a policy perspective, and then we publish it. Once it's published, we then usually will let the employees know of the new policy or the policy changes with any impacts they may have as well. Part of the COVID vaccine policy that we put in place at St. Mary's and at Mountain Health is that we do require everyone to be vaccinated. Now, unlike some hospitals such as West Virginia and in Charleston Area Medical Center, we did not make it mandatory. Now, they have to either take the vaccine or get a religious, medical, or just a plain declination at this time stating they do not want to take it, and then be subject to weekly testing. We will be starting that testing November 1st with our employees, but we're in the process right now of getting that done. The policy is in place. And one of the things that we're doing now is getting our testing policy in place. We're looking at probably having to test around 2,000 employees within Mountain Health that have decided this time they do not want to take the vaccine. So it's been a real challenge from a hospital perspective. We've encouraged people to take it. In some areas, in a lot of hospitals, it's a requirement. If you're going to work in a hospital setting, you are going to be required to take it. We have not gone to that route. We're encouraging our employees to take it, but obviously they do have the options of filling out the medical or religious or just a plain exemption at this time and going through our testing. We're going to be testing weekly. Our employees will be required to come to our Center for Education and be tested, and then we'll notify them if they are tested positive, and then obviously they would go through our quarantine policy. Our quarantine policy right now is run through employee health. That actually reports to me. If you wake up with a fever, sore throat, sniffles, you're not to come to work. You're to call to our employee health. We do have a couple sites set up within Mountain Health. We have a drive-in service at Cabell Huntington that you can actually go get tested. We also do have, one at St. Mary's where you can come to our parking garage and our employee health can walk over and test it. But we have told all of our employees that if you feel sick, don't come to work. And right now, between the two hospitals, we have about 200 employees right now in the quarantine due to either being positive or being exposed. And, we do watch them. We do testing as well as far as that's concerned. But it's very important from our perspective. We've had some issues with employees in the break room not using a mask. The next day they test positive, and there's 3 or 4 employees that are eating lunch with them. So they all have to go off and be tested and be quarantined because they were exposed. So we've spent a lot of time within Mountain Health as far as explaining the importance of proper PPE, social distancing, and making sure people understand if you are sick, do not come to work. One of the things, and Jamie covered this, it was really interesting listening to his presentation about emotional exhaustion. we have done a lot of research at St. Mary's, Cabell, within Mountain Health about emotional exhaustion, especially on the COVID units. And we've seen a lot of information where nurses are just getting out of the field. It wasn't what they signed up for. They're dealing with a lot of death, a lot of sickness. And ultimately, when you get into nursing, that's a portion of it. But to an extent, when you're dealing with the amount of sickness that we're dealing with right now due to COVID, it's really causing a lot of our nurses to have a lot of issues. And so what we've done at St. Mary's and at Cabell is we set up some amenities to try to help them. We have a rest and relaxation room now up on our COVID units. It's a break room that we just basically transformed, where we have chairs, and we have aromatherapy, we have massage chairs, we have our pastoral care and our EAP teams available, which is our teams that we use for people who are having issues. We have things that they have tablets they can listen to. We have cooling music. We're trying to make that as easy for them as possible, trying to make that relaxing for them. And we're also trying to give them some outlets, because what they're dealing with right now is really hard, not only for them, but for the families, because the families can't be with a lot of these patients because of the issues with the transmission of COVID. We also have introduced pet therapy. It's been something our staff has requested for a while. And so we've worked with that for a while, and we now have pets coming into that area as well. Pets are very relaxing. They're very calming influence for our staff, and it's been something that's very much been requested. We also have a very robust pastoral care, being a Catholic hospital at St. Mary's. And so we have them available. We have pastoral care available 24/7 to meet with our staff, to talk about issues they're dealing with, to help them deal with what they're seeing with on their unit and their floors. We've also provided that to Cabell Huntington, and in a lot of hospitals nationwide, you're seeing a lot of these things, a lot of the things that we're putting in place. A lot of hospitals are putting that in place as well, just to try to help our employees cope with the emotional exhaustion that comes with dealing with COVID patients. The other issue we're really dealing with, and this is a national issue, is there's not enough nurses. There's not going to be enough nurses to care for the baby boomer people that are retiring, people that have put their years in and that are retiring. There's not enough nursing involved. So what that runs into, and what we've run into, as I talked about at the beginning, was we have a lot of nurses that have decided they want to go travel. There's a lot of enhanced money to be made. There's a lot of areas in the country that are really, really short on staff, specifically Texas, Florida, some of the areas that have really been hit hard with COVID. And so what we're finding is a lot of our nursing staff are deciding that that's a route they want to have. What does that bring to us? Well, we have to bring in travel nurses. That's a challenge as well. So, between the two hospitals, we have about 100 travel nurses working between the two hospitals, and they're paid at an enhanced rate. So there's a financial cost to that, so we're paying travel nurses approximately $150 an hour to work in some of our COVID units and some other areas. And so it's a real challenge from that perspective, and how we deal with it. Obviously, testing and having people off work, having 200 employees off work, between a system employee every day is a real hardship on our staff. A lot of our units are working short, they're working overtime. And so what we've tried to do is, again, through the emotional exhaustion things we're working in, but at the same time, working in a medical center right now, working in a COVID environment is really difficult. And we understand that. I go out and round daily on the units with my proper PPE and talk to staff, and it's a really, really hard time right now to be in the medical center and to be dealing with what we're dealing with.
So that'll kind of conclude our presentation. We'll hand it back over to Nancy. I think she's going to help us with some question and answers.
Thanks, Jamie and Chris, for an enthusiastic, informative, and insightful presentation today. It will help us all think more about these employment issues and how to make the employer-employee work relationship work better. I'll now read some of the questions that were posted during the event and some that arrived by email before the event. We have some questions in the chat function. The first one it says, just curious, are flu shots voluntary or mandatory for hospital staff?
At St. Mary's, at Mountain Health, they're mandatory. Again, we do offer the religious and medical exemptions, but for the most part, we've had mandatory flu shots for the last 3 years within Mountain Health. And really, we don't have that many exemptions. Most people take the flu shot. We actually started that today, actually, and they've got through the end of October to complete their flu vaccine through Mountain Health.
Okay, great. Another question from the chat is looking for ideas for a small staff from around West Virginia working remotely. They are dedicated and just wonderful. Any suggestions for engagement and preventing the exhaustion of being remote for some employees?
I'll jump in first on that. That's a very good question. One of the things with work from home that we're noticing is that it can be also challenging, as probably mentioned here in the question. And the challenges we have at home are where there's no separation from, you're looking at a work-life balance issue. So you're working and your life is right there at the same time. Think about when we go to our work that's it's a physical location, there's a separation. So some of the things to help in the home environment is to make sure you have a separation. We were discussing this here recently, is that, you know, some individuals can work with multiple distractions. So they can be working, if you have kids, they could be hanging off of you. It's not a distraction. And then there's others that anything distracts them. So one of the key things you want to do there is you want to make sure there's a separation, that there's a separation between your work environment and your life environment. So people know inside your house that you're working, and you can control that. Some other things to look at just besides that part is remember that even though you're working at home and you can be swamped with work, is you still need to take breaks and you still need to step aside. I know, and I've worked at home, we worked at home since previous March, when we worked from home. Ours was a little different. It wasn't like an 8-to-5 job. So we had those breaks in time, but my wife worked at home for a little bit during that time period. And what she would do is she would take her lunch at a normal time, and she would actually eat lunch with us. And then she would actually go outside and take a walk, to take a break, to kind of break up the monotony of the work during that time period. So it kind of gives a reset before she would come back in and start her afternoon work. So I think, and Chris may be able to add a little bit more to this, but I think some of the big things to make sure you're not emotionally exhausted working from home is that, number one, you're separating yourself and your job responsibilities, but you're also taking time for lunch, taking time for breaks, and taking that little time for that mental reset, so to speak. And also take care of your health too at the same time. Chris, any comments?
Yeah, I think that's excellent, Jamie. I would agree with everything you said. One of the things we've done is we've actually been challenged to send a lot of our staff home right now. Our business office, centralized scheduling, a lot of our areas we've actually encouraged to work from home as long as they meet our productivity standards and we can measure them. One of the things that we've done with our at-home staff, we've been pretty flexible with their scheduling, as Jamie stated. You know, in the business office, for the most part, they have to be available to answer phones, but we've also been flexible enough that if they need to do other things, if they want to take a break, if they want to work earlier or take a break and work later, we've been flexible with them being allowed to do that. So we've actually been pushing a lot of our groups that can work from home, that don't have direct patient care, to work from home for a variety of reasons, because it is safer for them to be home than actually right now to be working in the medical center and be exposed to the things that they're exposed to. So I liked a lot of the suggestions. Jamie would concur with what we're doing the same things here at St. Mary's.
Someone else has asked if you see more of working remote work in the future. In other words, they probably mean once COVID's over, you know, once we don't have those worries, if we ever come to that.
I'll answer that, Jamie, and then I'll let you play on that one. Nancy, we're seeing a lot of that in areas where we're recruiting, specifically in information systems right now. A lot of the people the systems analyst people we're trying to hire specifically are wanting and basically saying, I want to work from home. They're not wanting to have an office space. And actually, in a lot of areas, we're doing that. And a lot of the people that we're sending home will never come back to the medical center. It frees us up space. Maybe we end up increasing, gives us space to bring on more patients, different things. But yes, that is a wave that we are going to be dealing with people working from home. Absolutely. And that's going to be a challenge from a recruiting standpoint, from a technology standpoint, from a productivity standpoint, because there's going to be these businesses are going to have ways in which they manage their productivity as they're working from home.
And to piggyback on what Chris said, I think I totally agree with Chris. I think we're going to see a lot more of this in the future. Of course, there's pros and cons to it. Some of the pros is, and I know Chris can probably attest to this, is that you have limited space inside the organization. And by allowing individuals to work from home, you're freeing up space inside the medical center there, or whatever organization you're using, you're freeing up space there that can be reallocated to other areas. So that's a big pro. I think another reason we'll see a lot more of this in the future is that, and if you could say, I hope this is right, comes out the correct way, if there was one good thing that came out of COVID, is that we see that a lot of we were forced into this. A lot of companies were very hesitant. They did not want to allow workers to work from home. There was that mindset that we can't trust employees at home. But then when you're forced into that situation, you had to make that adjustment. And not only that, we see that a lot of the organizations have invested a lot of infrastructure into allowing employees to work from home. So the companies have made this big capital investment to allow employees to work from home, whether it's setting up webcams like what we're using today, or giving people the computer to work at home or whatnot. And then employees are building their own offices too. So like Chris has said, they're wanting to work at home because they've already built that home office and they've invested in that part. So those are some of the pros. Also, another big pro that right now during the pandemic, if people are working at home, and as Chris said, this also is it's healthier. It should be in theory healthier for them that they're not into a situation where they have a chance of being exposed more because they're inside the house. Now, some negative things and kind of the things you worry about is what's going to happen to productivity. And I know that Chris talked about it earlier, that they've put some measures in there to increase or to make sure that they have productivity levels there. So we'll have to look at that. Now, there's some research right now that's saying is we have to be cautious with that monitoring system we have, because if we go way overboard, then the employees are not going to trust us as the organization, and they're going to want to go someplace else. From a personal standpoint, I like the work from home. I did not like the idea at the beginning. I'll be honest with you. I don't like being videotaped. I don't like to watch myself I will not watch myself being videotaped, but teaching from home, we were forced to do that. And I've got a lot more comfortable to it now. So I think that's another pro, that it's brought people out of their shells, so to speak, in that scenario. But also, if you look at it from a work-life balance, and this is one of the reasons that I like the work from home, and I'm sure other people can attest to this also, is that if we have a meeting and I can log in virtually, it's I spend roughly, by the time you get ready and drive to work, and I'm about a 40-minute drive from campus, I spend close to over 2 hours getting ready, going and coming back for one meeting that's maybe going to last, could last an hour. So that allows me to be more productive at home, not having to travel in for those meetings. So I like this idea. Obviously, as we said, there's some pitfalls. It's not perfect, but I think we're going to adjust to that. I think you're going to see more of that in the future.
Okay, great discussion there. We have another question from the audience. I believe I heard that nurses are being paid $150 per hour, assuming at minimum 8-hour day. That's $1,200 per day. 5-day week is $6,000 per week. And over 52 weeks, $312,000. How do you budget for such a cost? And how does it relate to the concept of fairness? That's a good question. In a lot of cases, we've heard throughout this presentation where companies are paying these incoming employees more, and it is curious how that will relate to justice.
Well, I'll tackle that one, and that's a great question. The challenge that you run into is, to an extent, it used to be it's kind of the supply and demand. There's more supply than there's demand. Now there's more demand than there is supply from a nursing perspective. So ultimately, we're challenged two ways. One, we can close beds and not allow people to come to the medical center, which is not really an option. Or one, we're forced to go out and actually bring in these travelers to help supplement staff as we continue to recruit and bring on nursing. I mean, we're going to nursing schools, we're recruiting daily for Mountain Health, as all hospitals are, but it's a real challenge right now. And so basically right now it's the market and what you're paying. Normally we would be paying anywhere from $50 to $65 for a ICU nurse traveling, what the normal market is. Because the market is the way it is, and because nursing is in such short demand, you pay what the market is. And right now the market says to get an ICU nurse, you're going to probably pay between $125 and $150 an hour to get them here. And ultimately, from a perspective, that's kind of some of the things that are being talked about at a higher level with Washington. Is a lot of these hospitals, it's physically straining on their finances. If you look at the smaller hospitals, they're having to do the same things, and it's a real struggle from a finance perspective. But ultimately, unlike certain hospitals, a Walmart, a Kroger's, where you can say, we're going to close at 12 o'clock, we're going to go 8 to 11 or whatever. In a hospital setting, you're 24/7 and you have to have your doors open. So ultimately, people don't care that we don't have enough staff. The answer is, I'm sick and I need someone to take care of me, or I need to see my loved one taken care of. And that's an important service we provide and will continue to provide through Mountain Health. But you have to have people to do those jobs. And so ultimately it becomes, you pay what you have to make sure that you can take care of your patients.
And to follow up on the fairness part, Chris and I actually discussed this the other day. As I asked Chris, when we talked about distributive justice here, what's it like with employees? The person beside you is making $150 an hour, and you may not be paid that. And he made the comment here, which is interesting, is that the employees are extremely happy to have the help. So they may be making that adjustment in that equity ratio is, I'm underworked or I've overworked, and maybe this help will bring that underwork back down. That's one way that maybe could explain that. But so yeah, it could cause issues. Obviously, it's not right now, but you can see what happens in the future when things hopefully get back to normal. And those prices will probably come back down. The salaries will come back down, and then you'll see how it works then.
Great. Another question is, has the turnover rate changed during the pandemic at St. Mary's Medical? And if so, in what way? And I think they're referring to current employees that are there. And you've talked about employees who have had to go out and isolate and maybe take care of loved ones. But how about actual employees quitting? Has that increased or decreased?
Yes, in all areas. Whether it's the housekeeper, food service worker, we've had nurses that have simply gotten out of the field, that have loved ones at home and scared they're going to take it home to a sick father that they're taking care of or whatever. We've had nurses, we've had LPNs, we've had PCS as patient care specialists that just said, I can't work in this type environment anymore. Not any reflection on St. Mary's or Mountain Health, just a reflection of the environment in which they're exposed to every day. And we're seeing that in all aspects, not as much on the employees that are working from home, but the people that are dealing direct patient care every day, from lab assistants. A lot of people, it's just in all areas that you're running into a lot of short staff and a lot of direct patient care areas, because the stress of working with these type of sick patients on a daily basis is just very stressful, and it's causing people to leave the fields.
Great. Another question is, with work-life balance being a current concern, are there any ways in which the COVID-19 employee issues have impacted the family dynamic?
Yeah, that's a good question. One of the things that we've noticed, and the census information is telling us also, or some of the surveys, let me rephrase that, is that the amount of women in the workforce is actually declining. at a rate of almost 3 times what the rate is toward the male. And what they're suggesting, or what the data is suggesting, is that during the pandemic, that what we had was the kids, if these individuals had kids, so somebody would need to watch the kids or help the kids with school and whatnot. So the women were leaving the workforce to do that role in the household. So we're seeing that, like I said, the government is showing that the numbers of the women have left the workforce, and that's the kind of the compounding reason there is to help with the children and the household with the work-life balance. There, you see that the lifestyle of the house kind of won out on that. And I think Chris and I have talked about this also. He's seen kind of the same thing at St. Mary's.
We have seen probably more women leave the healthcare fields in general, just because of the concern. I'm taking care of my older father, and I'm scared I'm going to take something home from work. And so we have seen people not and have said, basically, I'm going to have to resign or retire early. My hope is when this settles down and the pandemic is over, I can come back. I want to make sure I'm leaving a good standing, so I can come back when things settle down. But we have had a lot of people, just as Jamie said, leave the workforce because of those reasons.
Yeah, I was wondering about retirements. I wonder if, I often say to myself, the work world is so crazy these days. I wish I was at retirement age. Do you find more retirements now?
We do. We have seen a lot of people retire early. We have definitely, that's handled through my office here at St. Mary's, and we have had a lot of staff over the last year, since the pandemic really started up, that were close, that probably would have worked another 2 or 3 years, but have decided, based upon what's going on in healthcare, that they went ahead, took early retirement, and got out. So yes, we have seen that.
Yeah, and it'll be interesting to see the fallout we have from that in the future.
Absolutely.
Yeah. All right, we have time for one more question. And the question is, how has COVID-19 impacted St. Mary's Medical Center supply chain, and what effect is that having on employees? And it could really be anyone's. I think Jamie had mentioned supply chain issues earlier as well.
It's been a huge impact, from not having enough PPE to not having being able to get some of the surgical equipments we've needed in the past, to having to have oxygen delivered more often due to the number of people we have on high level of oxygen due to COVID being a respiratory illness. So it's been a great impact. We have, we're blessed to have great people working on our supply chain that work, but we've had to go outside of our normal vendors to work other vendors just to make sure we have enough supplies to take care of our daily operations. It's been very, very impactful in a lot of areas.
To follow up on that, I was talking to Chris, and I was hoping he would tell us. I thought it was kind of interesting. We were chatting about this the other day, and he said they've even ran out of Diet Pepsi syrup in the cafeteria there. They have to bring cans in now because they don't have it. But not really an employment issue there. I guess, it could be because the places that are making these products, they don't have the employees to do it. So yeah, there's issues with that. And again, you've got employees that are dealing with customers. That's what I was alluding to earlier. They don't have the product that's needed to sell, and the customers are getting upset. And it's not something it's just today, it's on an everyday basis. And you've probably seen in the media that customers are not getting any nicer. So it's kind of ramping that up a little bit more, and they're having to deal with that. So that's where we see that they're getting emotionally exhausted in the other industries, whether it's, retail or other types of industries.
Okay, great. This wraps it up for today's Herd Insights Small Business webinar. We thank our presenters very much, Dr. Jamie Halleck and Chris Mokas. Thanks for your time away from the hospital. We know what great work you're doing, and I'm sure, we really appreciate your fitting us in today. We'll have one more presentation. We'll have another presentation in this webinar series coming soon. Look for your registration email for the next event to arrive in a few weeks. We appreciate your participation today, and always remember, we are Marshall.